It's never too late to quit. It seems insurmountable, but it is doable because people have done it.
Yes.
Some people do cold turkey. Some people do the replacement therapy. And it's okay if you have a relapse. It happens. It's so hard. This is a drug that is designed. It directly stimulates our reward pathway. It is like the best thing that our brain wants, but it's the worst thing for our bodies.
Yeah.
So it's designed to be addictive. There's a reason why the tobacco companies and the vaping companies have made so much money. It's because it's so addicting.
Yep.
It's so hard to quit, but it's always, always worth it to try.
They said that we'd grow out of it. Well, the joke's on them, that's just our brains. We're eccentric, loud, and stubborn, and most of our clothing is covered in stains. It's not a deficit of attention, there's just too much to think about. So if executive dysfunction becomes a little too much, if you forgot why you came in this room, or you're hypersensitive to touch, then put on your seamless socks and come join our little flock. Bitches stimming together, we're weirds of a feather, weirds of a feather.
All right, we are recording.
We're recording.
We are recording.
Here we are.
In the cold, cold basement.
Keep picking these
Do I have to take that from you?
No.
You sure?
No.
You sure?
Excuse me. You're the one who killed my cat fidget toy.
Yeah, because you told me you had a second one. I don't have a second one of that one.
That's a bummer.
Yeah, so please don't kill it.
You're gonna really hate it when I kill this thing.
Please don't.
I'm trying not to.
He's just a little pig.
He is just a little pig.
In a big world.
I want to be a little pig in a big world. That
Same.
sounds nice. That sounds way better than being a human in a big world.
Yeah. You're not as aware of your eventual demise.
Yeah. Blissful ignorance.
Yeah.
That's
you don't
what
even
I
know
want.
about climate change.
Yeah.
Although maybe they do. Pigs are smart.
Pigs are smart.
What if they're just smart enough to be aware?
They're like, yeah, we're totally fine with our situation.
Or they're like, these goddamn billionaires are ruining the planet. What are we going to do about it, you know?
They're like about to take over the government.
God, I hope so. Someone's got to step in.
Someone's got to step in.
Why not the pigs?
I'd vote pig.
I'd vote pig.
I mean,
They're smart.
yeah.
They're surprisingly clean, actually. They're very clean animals.
They're clean animals. They believe in sunscreen. That's why they roll around in the mud. It's their sunscreen.
Yeah, they don't get enough credit for their intelligence. It's all about, octopus. Octopus are so
Australian
smart.
shepherd, dolphins,
Pigs.
Pigs. I'm pro pig.
I'm pro pig as well. All right, and with that, should we start the episode?
Yeah.
All right.
Yeah.
Welcome. You
Welcome.
want to do it? You do it.
I can do it.
It's your episode. You do it.
Yeah. Welcome to Weirds of a Feather, an AuDHD-Adjacent podcast. I'm your host, Kristin Stanhope.
And I'm your host, Grace Beret.
Welcome
Welcome.
to this depressing episode.
No, stop setting it up like that. You
I'm
keep telling
setting it up.
people it's going to be sad at the top. It's not as sad as you think.
I am a truth bringer. No, I make it happy at the end. It's good. It's going to have a happy ending. We're just going to get through it.
The fun, like we said last time, the fun is having knowledge. It's fun to know things.
It is fun to know things.
Isn't that fun?
Yeah.
Aren't you guys having fun?
Aren't you? So much fun.
Smile. Please.
No, we've got a meat heavy episode today. It's full of meat. It's charcuterie minus the crackers and cheese. So it's just meat.
It's just meat.
And like
slab of
garnish.
salami.
Yeah. Basically, we're going to learn about nicotine.
Yay.
But I got a warm-up question.
Okay.
I've been thinking about this a lot.
What you got?
All right. Grace.
Kristin.
What was your favorite cereal as a child? And what is your current favorite cereal as an adult? And why do you think there is a difference? And then for the audience members, for the listeners, bear in mind that Grace and I grew up in wildly different households where her mom was a nutritionist. And I don't know, does Suze even believe in cereal?
She eats like bran cereal.
Oh,
so we were not allowed to have sugar cereal.
No.
We had
Not even for like a dessert?
literally no, never.
Oh my
If
God.
she did buy anything close to the sugar cereal, it was like the Whole Foods version. What was the other store besides Whole Foods? There was another one.
Oh, yeah. There was a
That's where
Wild Oats.
Yes.
Yeah.
Where Trader Joe's is now.
Yep.
That was my mom's store, was Wild Oats. And she would buy like, instead of the peanut butter puffs, she buys like the koala peanut butter puffies, or it was puffins.
Puffins.
The puffins.
Yeah, no, we were too poor for puffins.
We had the puffins because we could not eat the sugar cereal. So growing up, I always wanted sugar cereal. It was one of those things that I obsessed
I always
over.
wanted the healthy cereal because it seemed more expensive and nice.
We should have Freaky Friday
Yeah.
and switch places
It
for
would have
like
been
a
cool.
week.
Yeah.
I would have made myself sick.
Yeah.
And you
My
would
mom
have
would've
not
been
had
like-
as much fun as you think you would have.
My mom would have been like, why are all of our stale goldfish are gone?
Yeah, they're eating everything in the cupboard.
Everything's in the cupboard.
So growing up, the cereal I liked, it was so boring. I liked Wheaties.
Wheaties?
Yeah,
Do
dude.
they even make Wheaties?
Yeah, my dad eats Wheaties all the time.
Oh,
my dad's a big
my God.
Wheaties fan. Wheaties,
might as
Wheat
well just
Chex,
eat grass.
and Cheerios were what we had. Wheaties, Wheat Chex, Cheerios, bran, cereal,
Oh my God.
and then the Puffins. The Puffins.
Puffins weren't your fave?
I liked the Puffins.
Puffins are great.
But then
bird
we didn't
and
get
the
them.
cereal.
Yeah,
Mhm.
I'm a big fan of Puffins all around. But even then, we didn't even get those that often. It was mostly like we just weren't a pro cereal household, I guess.
No. What'd you have for breakfast?
I don't know, eggs, yogurt.
Oh.
We would my mom would get like the shredded wheat,
Mm-hmm.
and you would put like a little natural maple syrup on top of it. That's
Mhm.
actually not bad. The little circles of shredded wheat. This does not sound appetizing at all as I'm
No.
describing it. And it
No.
wasn't. And that's why I was always upset.
Your sad
So-
childhood.
Yeah, as a child, I wouldn't call it a favorite cereal because none of them were like a favorite. It was just something I ate, but I liked Wheaties with bananas in there. But then as an adult, my favorite is Captain Crunch Peanut Butter Crunch.
Okay.
Always, even though it shreds the roof of your mouth. Ever since I was able to buy my own
It's
food,
a solid choice, though.
right?
Yeah.
Ever since I've been able to buy my own food, that has always been my number one go-to is Peanut Butter Crunch.
Nice.
What are yours?
Well, so I grew up in a wildly different household where we had all the snacks and stuff because
Mhm.
snack food like Doritos and stuff is cheap, and my mom's just trying to feed us on no money.
Mm-hmm.
So I loved Fruity Pebbles,
Ooh.
which kind of now thinking about it is gross because it all like mushed together to
Yeah,
make
you
like
gotta eat them really fast.
No, I would wait till they form like a slop.
Ew.
Oh yeah, this is
Gross.
except you would get that like one Fruity Pebble that's like extra hard. It was like left in the sun or something. I don't know, and it would like break your teeth. But I would wait for it to get, and I'd have this like mush, this Fruity Pebble mush. It was
And you
delicious.
wanted that?
Loved it.
Ew.
Oh, it was my
Something's
favorite.
wrong with you.
Now as a full grown adult,
Mm.
Cinnamon Life, 10 out of 10.
Ooh.
10 out of 10 for me.
I don't know
That's
about 10
it.
out of 10,
That's
but
it. That's all I need. Or Cinnamon Chex, also fantastic.
yeah. Yeah.
I
Those feel like boring choices to me, but
it's boring, but it's so good. Like I'll never say, oh, like I also love, have you ever had that? It's a newer cereal, Crave.
no, but I've seen it. Is
It's
it like chocolate
It's
inside?
there's like chocolate inside. It's dangerous,
Mm.
but you can't beat Cinnamon Life for me. It's perfect. I want nothing more.
I'll go through phases where I'll be into Cinnamon Life and then I like get burnt out on it, but I'll go through waves, and that's one of the things I get.
Yeah.
Same with Frosted Mini Wheats.
Ooh,
Kind of go through
that's a good
cycles of
one.
those too.
Yeah.
I don't eat a lot of cereal now.
Mm. I do as like a dessert.
Yeah, I was
almost.
gonna say, I
like
don't
an
eat it for
extra. Like I
breakfast.
need like a little snack. Yeah, I don't really. I'm doing a lot of breakfast sandwiches for dessert. For breakfast,
Mm.
and then I'll do like cereal as like a little treat for me,
Same. Yeah.
or
I'm-
like girl dinner.
yeah,
Mhm.
I'm more likely to eat cereal as dinner.
Yeah.
Just like Kellogg's owner
Yeah,
told us to.
Yep. We're
Can't
just
afford dinner? Try cereal for
try
breakfast.
cereal for dinner.
It's not dystopian at
I
all.
hate this country.
Yep.
All right. Well, cool.
All right.
Grace,
Yeah,
do you have some accomplishments you want to share?
I do. I have one specifically.
Do you want to do the song?
Yeah, let's do it.
Yeah. Let's
right.
do it.
Little accomplishments, but big in our hearts.
Yeah.
My accomplishment, and maybe this won't sound like an accomplishment, but those of you who know me know that I have trouble branching out, trying new things, especially when it comes to podcasts.
Yeah.
If you've given me a podcast recommendation before, I'm so sorry if I haven't listened to it because I do not respond well to recommendations. Even though I want them, I want to listen to these things.
I'll take your recommendations. I'm stopping things and starting new things. I love starting a new thing.
I do not. I want to have already been doing the thing and then I can come back to the comfort of a thing.
Yeah, I have my comfort podcasts that I listen to, but I also like listening to new things, but I have to have a pitch.
Yeah.
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 I can't just be like,
hooked.
This looks good. I need a pitch.
I'm finding that I am much more receptive to trying a new podcast if I've been able to see clips of them on TikTok. Because I'm like, I get it.
Okay.
I know that I like this vibe.
That being said, we should have clips on TikTok. Oh my God, we do.
Oh my God.
Yeah. Check us out on TikTok.
Check out our little animations. And at some point, we'll do real video of us as well. But for now, we got those animations. But yeah, I just overall am very, very oppositional to trying recommendations. Not in a purposeful way. More like something in my brain and body, I just cannot get myself to try new things. With that said, I started listening to a new podcast and I absolutely love it. I'm obsessed.
Is it the one I recommended?
No, it's the one I recommended to you. It's called Brooke and Connor Make a Podcast.
Oh.
Yeah. It's the I have purse.
I have purse.
Clip, I have purse. I have shoe. I have hat on head. I've always loved their clips on TikTok, but for some reason, I just never listen to their podcast. I do that a lot. There are people that I like. Caleb Huron on TikTok. I absolutely love him. I think he's hilarious. I just don't listen to his podcast, but I should. But with Brooke and Connor, I finally started listening to their podcast because I love their clips so much. And I absolutely love it. They talk about nothing.
Sometimes that's what you need, though.
They are hilarious. I just love their dynamic. I think Brooke is so funny. I love her style of comedy. Connor, too. But I think Brooke is, the shining star. They're both wonderful. I just really enjoy their friendship. And that's been a real comfort to me. And I'm proud of myself for trying a new thing.
I'm excited.
New-ish thing.
A new journey for you.
Yeah.
Yeah.
And it's a really nice podcast to just throw on and have when you're doing bullshit. So it's motivating me. It's getting me off TikTok because I have something that's still fun and enjoyable.
Yeah.
I'm just having a great time with it.
Yeah.
What's the one you recommended to me?
My Victorian Nightmare.
Oh, that's right.
I love her. And I want...
The next time I go through a more of a horror podcast phase.
She's fantastic. She's got a nice sounding voice. And I binged it one weekend and now I have to wait for new ones to come out every week.
I hate that. I hate when you catch up.
Yeah. Because it's a fairly new podcast. I think there's only 30 episodes, but it's worth it. It's worth it. She's fantastic. And I wish I knew her name.
Oh, well, there's no way to know. Yeah, that's the other problem with taking recommendations is that I go through big phases of sometimes I just want a silly haha podcast and other times I want a serious story or more of the horror stuff or true crime.
Yeah.
But I feel I get a lot of recommendations for that type of stuff when I'm in more of a silly casual mood. So then I forget about them and people, I'm sure I hate when people don't take my recommendations, but also I'm bad at taking recommendations. So I get it on both sides of it. And I wish I wasn't like this. But
it's got to be the right recommendation.
Yes.
When people give you a recommendation, you're I would never listen to that. That is not if someone's let me recommend this finance podcast. I'm dude.
Yes.
Do you know me?
What about me makes you think I'm going to listen to that?
I'm not listening to that.
No, my brain just will refuse.
Yeah.
But yeah, if you out there are good at taking recommendations and you just want a silly, laid back podcast, kind of like this, but a lot less informational.
Yeah.
Somehow.
Well, we have our silly days.
I know, but even then, I feel
today's not a silly day.
No. And even on our silly days, I feel we're still usually providing some level of information. Brooke and Connor are really just kind of talking about current events, what's going on. So truly,
the thing is, we don't watch the news. We don't know what's happening.
I mean, I don't watch mainstream news, but I am absorbing certain news, but it's more the horrors of the world. They're not talking about news. They're talking about gossip and pop culture and stuff like that. So it's a good escape if you need to turn off your brain for a bit and the world is freaking you out and you're getting anxiety every single day and you're paralyzed and you need something to snap you out of it. Put on Brooke and Connor Make a Podcast. It's really, really lovely. All right, Kristin, what did you accomplish?
I repotted a plant that needed it.
Nice.
It's like a vining plant. So I have a moss pole. Do you know what a moss pole is?
Tell me.
It is a pole of moss,
That's
basically.
what I was going to guess.
Yeah.
But
Well, it's
it
not
seemed
even
like too simple.
This one's not even. It doesn't even have moss on it. It has like
It's just a pole.
some sort of like pole with like rope twined around it. Twine wrapped around it. Sorry. So it had a moss pole, but it outgrew its moss pole. So I needed a bigger moss pole.
Sometimes you outgrow your moss pole.
And it outgrew its pot. And every morning I would like look at it, and it's just this like sad plant being like, help me. And it wasn't dying, but it just like wasn't doing well. So I got all the stuff, and then I had the stuff just sitting in my living room. And
Taunting you.
Picked a day, and I was like, this is it. This is happening. And we did it, and we
Nice.
got through it. It was a little bit of coordination because the vine's really big. So like I just needed like one more hand, but I did it myself.
Nice.
And now it's happy. It's a happy little plant. So
Great.
I'm excited.
I'm proud of you.
Thank you.
I hate having that constant reminder of something you need to go
You're like,
do
I need
every
to
single
take
day.
care of
and you
this.
just feel shame
Yeah.
every time you look at it, but you
Shame.
don't do anything to fix it.
And then when you do it, it's like I like generally enjoy taking care of my plants, but
Yeah.
like I just feel like I've been so depressed that things that are enjoyable to me are no longer enjoyable. They seem like tasks. So
that
that's fun to go through.
It's really a fun stage in life.
Yeah,
you know?
where you're like, even things that I once enjoyed seem like overwhelming.
Yeah. Nothing brings you joy. Really.
Yeah. Fun.
Fun.
I love it.
Yeah. Here's the fun we promised in this
Here
episode.
we are.
Yeah.
But yeah, I did it, and it's a happy little plant. And then I just kind of like got going, and I had a little day of plant care, and
Yeah.
so yeah, it was really nice. I even bought myself a new little bonsai, pre-bonsai. I realized all my bonsais are pre-bonsais because they're not good.
So just like a little tree.
It's just a little tree. I wouldn't even say it's a tree. It looks like a shrub.
Huh, just a little shrub.
Little shrub, but we'll see.
You'll shape
Maybe
it
one
into
day.
a butte.
Yeah.
Or it'll die.
I had like a moment. I'm like, all my work, because my best tree that looked like a bonsai died. So then I'm like looking at all my other trees, and I'm like, these aren't trees. These are bushes.
I mean, I feel like a bonsai can be a bush, right?
No, the whole point of it is it's supposed to be a tree.
Oh. Why'd you buy bushes?
I bought bushes for the point of making them into trees. I have to shape them into a tree.
So it's a bush until you shape it, and then it's a tree?
Yeah.
That's not how trees work.
Well,
Trees are trees and bushes are bushes.
you can buy a bush, and then you can make it into a bonsai by selectively pruning it and growing it so it proportionally looks like a very small tree.
Okay. So it's a bush that looks like a tree.
Mhm.
It's not a tree.
Not a tree.
Some of them are trees, though, right?
Some of them are trees.
Some
They're
of them
just
are
very
bushes shaped into trees.
Yes.
Okay. Glad we cleared that up.
Yes.
Yeah. All right.
Did you learn nothing from our second episode ever that we did?
I guess not.
All those years
It
ago?
left my brain. I know that was so long ago.
Also, your husband, who's like super into bonsai, part of the Bonsai Boys.
Well,
Club?
I thought they were just all trees.
No, they can be bushes.
Oh.
It's the beauty of it.
That is the beauty
It's
of it.
all proportion.
You're right. Well, I'm glad you refreshed my knowledge on
Yeah.
that. Yeah.
You're welcome.
Thank you. All right.
Yeah.
Serve us up some of
got
that meat.
I got meat. I've been thinking about this meat. It's been on my mind. I'm ready for this episode to be out into the ether because it's a lot of information. And I just want to give a disclaimer that there's so much information on this topic. It's really hard to just narrow it down to an episode. But I did. I think I covered the big things and the things that I thought were important.
All right.
And here we go.
All right.
Let's talk about nicotine.
Okay.
Nicotine. And ADHD. That's the meat.
All right. Got meat on the mind.
I got meat on the mind
Yep.
and nicotine on the brain, but not really.
Yeah.
Because I don't.
Have you ever tried nicotine?
I have. I've like smoked a cigarette.
You have?
Mm-hmm.
I haven't. I've
You
never
haven't?
smoked a single cigarette.
You've never smoked
When did you? No, never once.
I think I was
I've
very
never taken
drunk
a
at a bar.
single puff of a cigarette.
And someone was like, "You want a cigarette?" And I'm like, "Yeah."
I can't believe you did
Oh
that.
man, I was in my 20s, reckless. How am I not dead?
I don't know if that would be
I think
described
we
as
are-
reckless. I think for you,
Reckless for
comparatively,
me.
you were reckless. But like
I've
smoking a part of a
also-
cigarette one time when you were drunk, I
You
don't know
know,
if people would say reckless.
I would also do is ask for cigarettes and then throw them on the
Smash 'em on the
ground.
floor.
Yeah.
Yeah, me too. Yeah, we both did that.
We're both assholes.
Yep. Yeah.
And you know, after this episode, I might still do it.
Yeah, same. If I'm drunk, there's no telling what I'll do. You know?
Yeah, it's smoking is bad, but it's also incredibly hard to quit. So I want to. This is not being like smoking is bad for you and you're ruining your life. I don't want to be like berating the public because it is.
It's about harm reduction. We're taking back the DARE movement. We're reinventing the DARE movement with a more harm reductive approach.
Yeah.
Yeah.
Yeah. It's
knowledge is power.
This is not to say like if you're smoking cigarettes or vaping that you're a terrible person. It's to say that like there's been so many studies on why this is bad for you and just take that into consideration.
Yeah.
And also it's stupid hard to quit, which is why these companies are so successful because it's hard to quit. It's very addicting.
And that's why I've never tried it before. Not because I'm like superior to people.
Yeah.
It's because I know just how hard it would be to quit and I know I would get addicted. And so I don't even want to know.
Yes. I've had patients tell me it was easier to quit heroin, easier to quit meth, but they'll never quit smoking,
that's
you know?
crazy.
Which is wild. And we'll find out about it. So kids, because we have kids who listen.
Yeah.
Don't just don't even start, because I think that's the best way to not have an insane and an expensive smoking addiction is to not start it, which is incredibly hard now that there's vapes, which I didn't even want to bring up the whole like how vaping is so insidious among the youth of America right now.
It is, though. It's important to talk about,
you know? Maybe we'll do it on a different episode because there's so much here that we've just got to get into it.
Yep.
So what is nicotine? Do you know what nicotine is?
No.
It's
plant.
It is. It's a plant alkaloid. It's a chemical found in the nightshade family, which also, including tobacco, includes eggplant, potatoes, and tomatoes. Nicotine is excreted from the plants and helps keep pests from eating it and the leaves.
Whoa.
There used to be nicotine-based pesticides that we would spray on everything. But then these were banned in both the U.S. and Europe due to the many health concerns to humans.
But they don't have health concerns for the current pesticides being sprayed?
We don't have all that. We have to move on. We can't even get into it.
It just seems crazy.
It's one of the pesticides that has been banned because there's many health concerns, but there's also environmental harm. Basically, it killed a bunch of bees.
Bees?
Bees! So, yeah. So it's technically a natural little compound found in plants, but we have harvested it, and now we can consume it for pleasure.
Right.
And how do you consume that? Well, most often people are smoking it in cigars or cigarettes. But now there's vaping, which is fairly new, which is you're inhaling like heated up nicotine, basically. You can consume it orally with like chewing tobacco, those like Zyn pouches, gum. They make lozenges. Transdermally, they have nicotine patches. That's like really common for people who are on like nicotine replacement therapy. And they even have nasal sprays for people who are trying to quit. Which is interesting. I didn't know they had that. I didn't know that.
Is nicotine, maybe you'll cover this, so tell me to shut up, but is nicotine itself bad for you at all, or is it the cigarettes?
Yes.
So nicotine on its own?
Nicotine is bad.
Like even wearing the nicotine patches is not like great for you, it's just better than smoking cigarettes?
Yeah.
Okay.
Yeah, exactly.
I just learned this morning, actually, that cigars had nicotine in them from the Burke and Connor Makeup podcast.
Yeah.
I don't know. I feel like you don't hear about people being like addicted to cigars, but I guess they are.
Yeah.
They just like, it's just kind of like a old man thing to do. So you don't like think about it as much.
One, I think it's more expensive, right?
Yeah.
I mean, cigarettes are expensive. Vaping is expensive, but cigars, my understanding is that maybe there's like a more of an art form to it. So they're more expensive. Plus they're like bigger too. Yeah. Like you can just like bum through like up your cigarette
for a while.
But
so
a
people
cigar,
like gnaw on those
cigarettes
on cigars.
Yeah, because they're trying to get the nicotine.
Yeah, they'll like chew it up. Gross.
Nothing's grosser to me than chewing tobacco.
Yes, I think it's vile.
Dipping is like the worst thing.
It'll give you gum cancer so fast.
Yeah, it's pretty vile, and it's like I don't want to tell people what to do with their bodies, but I'm like, please, for the love of God, do that away from me, because I just think it's so absolutely foul.
Well, yeah,
because then you have to like spit it out in a
brown
bottle,
liquid.
And it's like,
yeah.
ugh.
Well, it's one of those things that just impacts. It's not about telling someone what to do with their body. It's that it impacts everyone around you, just like smoking cigarettes, where it's like, this isn't just a you thing. If you're just wearing patches or whatever, I don't give a shit. Do whatever you want. It's your body. But yeah, if you're going to like impact others in your environment, it becomes a problem.
Because there's secondhand smoke and there's also thirdhand smoke.
Yes. Yeah.
Which is crazy.
Yep.
So yeah, this isn't berating, except when it comes to chewing tobacco.
Yeah, I feel like that's the one thing that I'm like, I don't care about being judgmental.
I can't even look at, and you've got that like wad, and you're like, ugh,
I know.
I can't. Anyway.
Sorry for all you
chewers
out there. Yeah. But like, come on.
So kind of based off your like, is nicotine bad for you? But what chemicals are in cigarettes that are bad for you? Quite a bit. So nicotine is not great for you, but there's so many chemicals in cigarettes that are also very, very bad for you. So let's get into it.
Please.
So one of them is called butadiene. Which is a chemical that's also used to manufacture rubber.
Cool.
It causes cancer, a lot of blood cancers like leukemia. Arsenic, which is a poison by Victorian ladies, but also used to preserve wood, and can cause cancer of the lung, skin, liver, and bladder. Benzene is like a chemical to make other chemicals. I think it's in a lot of hairsprays and spray sunscreens. But it can, in particularly, is linked to leukemia. Cadmium is a heavy metal used to make batteries and has been associated with kidney cancer and prostate cancer. Chromium-6 is also another metal used in paints and dyes. Causes lung cancer and has been associated with like cancer in the noses and nasal sinuses.
Oh my God.
Formaldehyde is also in cigarettes, and that is used to embalm bodies, which is great. And it's also used to make like resins and other sort of preservatives. It's been linked to leukemia and respiratory issues. Polonium-210 is a radioactive element that has been shown to cause cancer in animals. And then tar, it's not really one single chemical, but it's kind of like the amalgamation of many different chemicals in tobacco smoke. It leaves this like sticky brown residue, which gets on your lungs. It gets on your teeth. Like a lot of smokers have bad teeth.
And your tongue.
Your tongue, on your fingernails. You see smokers, especially the fingers that they smoke with will be stained brown.
Yeah.
It'll get on your clothes. It'll get on the walls of your house if you smoke in your house. That's why, like, if you rent an apartment, you're not allowed to smoke in there because they have to, like, do, like, a major clean. Or if you've ever had the unfortunate thing of, like, cleaning up after, like, a relative of yours has passed and they were smoked in their house, their walls will, like, be covered in tar, and it's gross.
You know what else that happens with? It's like Yankee candles, scented candles.
Really?
Oh my God. Yeah, I saw it on TikTok of this person's house who had died, but they always had those like 3-wick Yankee candles burning. It had like coated everything.
I bet. Yeah.
It was like
that's
huge
wild.
like film on all the walls.
But that's what cigarettes will do if you smoke inside your home or in your car.
Yeah.
You'll never get that out. But and on your furniture too.
Yeah.
So
I think people don't realize, because you just become habituated to it. You don't realize just how much it soaks into things.
Everything, right? And then in vape, there's also a lot of chemicals. So a lot of people have this preconceived notion that when you vape, it's just nicotine and it's better. I would say technically we still don't have long-term data on vaping.
Yeah, that's the scary thing.
Yeah, so we still don't have long-term data on vaping, but the short-term data does not look great.
But slightly better than cigarettes,
right?
If we're talking harm reduction.
Originally used to... vaping was originally created as a way for people to cut down on smoking cigarettes because cigarettes are pretty harmful.
People are like, surprise, I'm just going to turn this into an addiction itself.
Yeah, exactly. Well, because nicotine's so addicting. So what else is in vapes besides nicotine? You have propylene glycol, which is antifreeze. You have vegetable glycerin, heavy metals like lead, nickel, arsenic, and chromium. Formaldehyde, once again, used to embalm bodies. Acetaldehyde, which is a precursor to a precursor of wood glue, I think. Don't quote me on that.
Right.
Acrolein, which is an herbicide, and toluene, which is in paint thinner.
Oh my God.
So not great.
I'm glad you covered those because I feel like, you don't really, because it seems like, I don't know, it's just like a puff of air. It doesn't, it's not like really stinky like how cigarettes are.
Yeah.
So it seems like it's cleaner.
And it is.
But it's still got all those chemicals in it.
Stuff. Yeah, it still has stuff in it. And it's still causing harm. And we're going to talk about it. So how does nicotine work? So nicotine is absorbed into the body, either like through the alveoli in the lungs, through the mucosa in the mouth, transdermally, transnasally, through the bladder mucosa, the GI tract if you're just eating it. However you consume it, it is absorbed, and then it goes through the blood, and then it's very good about crossing the bloodstream, the blood-brain barrier, and then it goes right to your nicotinic receptors, which are a type of anticholinergic receptor, and those receptors are found all over the body.
You're nailing these pronunciations.
Well, because we learned about them in PA school.
Still, you're nailing them.
Thank you. I've read them before. So in the brain, they're associated with lots of neurotransmitters like dopamine, norepinephrine, acetylcholine. So when nicotine especially is an agonist on the DAT, the dopamine transporter protein that we talked about quite a bit for our Bowling for Dopamine episode.
I remember that.
It directly stimulates the dopamine reward pathway, which is why it's so fucking addicting.
Danger.
Yes.
For everyone, but then especially ADHDers. God.
Well, let's talk about it. So it's a dopamine agonist, which means it kind of stimulates the dopamine. Ingesting nicotine causes this like quick release of dopamine stimulation. I'm not quite sure. And is it directly stimulating the release of dopamine, or is it directly stimulating? I think it's directly. I read a couple different articles, and I think it is like directly stimulating the release of dopamine.
Okay.
I don't think it's stimulating or inhibiting the reuptake of dopamine.
Okay.
And which makes it like it's such like this. You feel so good after smoking a cigarette because you have this huge dopamine hit.
That makes sense.
On a cellular level, nicotine also causes the release of catecholamines, which are stress hormones. They help release norepinephrine, which is like the fight or flight, released in the fight or flight response. It reduces the cell's ability to undergo apoptosis, which is the cell's way of like offing itself when it's time, which is important. It's important for cells to die when they're ready.
Yeah.
And it also affects your HPA axis, which is a major pathway in your body that has to do with cortisol release.
This sucks that it's bad for you because like all of that, like imagine if that was a good drug for us. It sounds great.
Yeah. And we're going to talk about, they actually kind of like looked into maybe this could be a way for drugs to be, they looked into it, and we'll talk about it in a little bit. But yeah, it's like directly stimulating all of the parts that someone with ADHD would want stimulated.
Yeah.
You know?
Yeah. Like, of course you're going to get extremely addicted.
Of course it's stupid addicting. And of course people are on this for life. It's literally designed to be addicting.
And like, again, if you just never try it in the first place, then you don't even have to live with that knowledge. Because once you know, now you have to live with that for the rest of your life.
Right.
Like for some people.
Ignorance is bliss sometimes.
Like I've heard from people who quit 20 years ago and they're like, I still think about cigarettes every single day.
Every single day. Yeah.
It never leaves your brain. Once you have that knowledge, now you have the knowledge.
Wild.
Nothing will ever feel as good as that feels. So just don't even, if you haven't tried it yet, this isn't a judgment. It's more so a self-preservation. It's going to be more work to resist it if you know how good it is.
I won't lie. I think working in vascular surgery where it's like 90% smokers, I think by the end of my time in my vascular career, I was a little judgmental. I'm like, how could you want to, after getting toes and limbs amputated, how could you still want a cigarette?
Yeah. And that shows just how addictive it is.
It's so addicting.
People are losing limbs and they still can't stop.
And they still can't stop because nothing's going to feel as good.
People with lung cancer, you know, people on oxygen.
Yes.
It's crazy.
Yes. Also, PSA, if you are on oxygen, for the love of God, for the love of your house and your face and your throat, take the oxygen off before you light a cigarette. That's a fire risk.
Yes. Don't blow yourself up.
Don't blow yourself up. Don't blow your face up. Okay. Getting back to smoking. So smoking is the #1 preventable cause of death in the U.S. Here's how it affects the body. This is not an all-encompassing list. It's a big list. We could talk about all the different cancers all day.
Let's not.
But let's not.
Yeah.
We're going to talk about a little bit of cancer.
All right.
But not all
Sprinkle.
the cancers. So we're going to start top. We're going to go from the top and work our way down.
Right.
So the brain, smoking can increase your risk for certain type of dementia, such as Alzheimer's. And then babies who are exposed to smoke in utero have significant cognitive deficits. And then the smoking is the leading risk factor for stroke.
Whoa.
So that is just the brain. In the lungs, so the lungs are kind of like obvious lung cancer is like, smoking is the leading cause of lung cancer. One of the leading causes, you also have like asbestos and work-related hazard.
Mesothelioma.
Yeah, mesothelioma and all those things. But smoking is like #1. There's a thing called popcorn lung, which is associated with vaping, especially in the youths and the teens. Basically, your alveoli. So imagine your lungs are filled of like these little microscopic air-filled grapes. Those are called alveoli. They're filled with air, and then they're covered in little tiny capillaries. And that's where the blood can exchange CO2 for oxygen, right? So the more little clusters you have, the more capillaries can be covered in those clusters and the more exchanging of gases you can have.
Okay.
Rather than like one big grape, you want several mini grapes because the surface area is more, if that makes sense.
Yep.
With popcorn lung, your alveoli turn from many small grapes into one giant grape called a bleb.
Oh.
And so it's harder for that gas exchange. It's a very similar process to emphysema, and this damage is permanent.
Oh, God.
There's no reversing it.
God. Why'd they give it such a fun name, popcorn lung? It sounds like a treat.
I think it looks like popcorn under a microscope. There's something called EVALI, which is e-cigarette or vaping associated lung injury.
Are e-cigarettes the same thing as vapes?
Yes, they're the same.
They just are the shape of cigarettes?
I think when they first, I don't know, but they're the same.
I want to say that's the difference, is that when I think of e-cigarettes, I think of like an actual cigarette, but it's just, I was going to say digital.
Yeah.
It's vapor as opposed, but whereas like the actual vape is like, looks more like a little handheld machine.
They're the same.
Okay.
they're
same
both,
thing, just different forms.
Yeah.
Okay.
So this is most often associated with THC products.
Womp womp.
I know, but I do want to touch on it here because we're talking so much about smoking.
No, we should.
And I think eventually we'll get to ADHD and marijuana, but it is really important. Remember pre-COVID in 2019, all those young kids were ending up in the ICU for vaping related issues.
Yeah, because they're like all these random chemicals.
Yes, that's EVALI. So the CDC was really keeping track of it until obviously the pandemic hit, and then they had like bigger things to worry about. But they're still kind of keeping track of it. So from what I've read, it's almost always THC products, but one article I read said it might be some nicotine products. EVALI is fairly new, the height of it being in 2019. And so now since the pandemic and all this stuff is happening, we kind of like, not that we lost track of it, but we were really keeping track of the pandemic.
Something overshadowed it.
Yeah, exactly. What we do know is that it causes severe inflammation of the lung, the tissues in our lung, and it leads to poor oxygen exchange, scarring, and pneumonia. Patients with EVALI are often hospitalized, often require mechanical ventilation where there's a tube down your throat breathing for you.
God.
Per the CDC, 15% of all cases are in children under 18.
Oh, my God.
Right. So
that's scary.
I know.
Kids are just doing more and more drugs these days. I know kids have always done drugs. But
Kids
I feel
have always done drugs. It's just that the drugs
more
are
accessible.
different. And probably more accessible.
They're higher tech. So was that from vaping THC in general, or was it because the cartridges are so unregulated and there were like pesticides and shit?
I think it is, from what I've read, E-Valley was mostly from that vitamin E acetate chemical being in the liquid, the THC liquid that you're supposed to smoke.
Yeah.
So it's basically, there's a chemical in the THC cartridges that is causing all of this. And so it sounds like now it's a little bit more regulated.
Yeah.
Because we haven't really heard from it. But once again, there's a couple other things overshadowing E-Valley right now, like bird flu and COVID-19 and all these other things. But back in 2019, it was wildly unregulated.
Yeah.
And I think they've also made laws where like you have to be over a certain, like it used to be like anybody could buy vapes, right? So now you have to be over 18 to buy a vape.
Well, I think you always had to be at least 18.
And then how old do you have to be to buy THC?
21.
21. So,
well, also weed was like legalized in a lot of states all at once, and like so many dispensaries were just popping up in so many states.
Right.
Like the regulations just couldn't keep up, and so anyone could, for the most part, make these cartridges when it needs to be a very specific compound of stuff. And so I heard a lot back in 2019 about just like these off-market THC, or even you could buy them at dispensaries. You just like, if you didn't check into like where they came from, people were just, I don't know, putting whatever in there.
Right. So it's a little bit more regulated of a market now. So I think we are hearing less of this, but it's still a thing that is happening. And the other thing I just wanted to talk about vaping that I didn't write down is that you also have, this was kind of in the beginning of vapes, you can have malfunction vapes that can lead to like severe burns and either like if the vape's in your pocket, it can like burn your skin in your pocket, or people who are inhaling it and have like a battery malfunction or something.
Weren't they like blowing up and shit?
Yes.
God.
Yes. And then you would have like people had to have like the hole inside of their windpipe was burnt from the inside.
God.
So they'd have to be in the hospital with a tube breathing for them in like a medically induced coma because of a vape injury. But don't worry, vaping doesn't want you to know.
I feel like just like me wearing my helmet when I roller skate, because I do not want to be known as someone who has a TBI from a roller skating injury. You don't want to be known as having a vape injury. A vape coma. Come on.
It's like a horrible thing.
It's just dorky.
It's awful.
Yes.
I don't know if it's dorky. It's like,
well, I'm trying to make it
devastating. And you'll have like permanent damage and
I feel like for the youths, sometimes the scare not that you're doing scare tactics, but I feel like knowing the facts and information.
That's what we're doing when here, facts and information.
I feel like when you're a kid, you're like, yeah, whatever, adults just say that. But I feel like if there's also a social component of like, no, it's also just like kind of dorky. I feel like, I don't know, that's just one more thing that's like a downside to it. It's not even cool.
Vaping shouldn't be cool. Stop doing it.
I know, but look how cool people thought cigarettes were for so long. And I feel like a big turn in the tides for cigarettes was when the public started to be like, actually, maybe those aren't cool,
It's like really bad for you. So this is why we're doing this.
So public perception definitely, has an influence on these things as well. And if all the teens are doing it, you do think it's cool because everyone's doing it.
Don't do it.
Don't do it. Don't get a vape injury.
Let's talk about heart disease.
Please, I've been waiting.
Smoking is the leading cause of coronary artery disease, and which is when little plaques, little blockages build up in the blood vessels that supply blood to the heart. So the heart, even though it pumps blood, it also needs blood. It's a muscle. It needs blood to work. So what will happen is your coronary arteries, your heart arteries, will get these blockages and cut off blood supply to sections of the heart. And that's a heart attack. That's what happens when you have a heart attack. And then for your gut and your taste, so smoking can change the way you're able to taste. Basically, you just lose
your papillae.
Yeah, your taste buds become shit.
Fucks up your papillae.
Yeah. You can also get this thing called mesenteric ischemia, which, just like coronary artery disease, these little plaques build up in the blood vessels that go to your gut, preventing blood flow from getting to the gut. And since your gut is also made up of muscle fibers, you don't have enough blood flow to the gut, so you can get extreme pain and cramping every time you eat. People with mesenteric chronic, you can have acute, which is like acute mesenteric ischemia is when usually not from smoking, but it's basically when some sort of like clot or maybe a plaque breaks off and it like completely blocks an artery and like half your gut dies and you need to get that taken out. Or you can have chronic mesenteric ischemia where chronically you have this cramping every time you eat. And so people can have like a lot of weight loss because they don't eat because they have food fear and they avoid eating because it hurts every time they eat. So they usually are these like very thin women with this very long smoking history and they don't eat because it hurts every time they eat.
I always thought of cigarettes as keeping you thin because of like the nicotine, but it seems like this is another aspect of it.
Less common. Usually people are thin who are smoking because they get the dopamine from the nicotine and they don't feel like they have to eat. You know, they use it as a replacement. Like I think this is a bad example. Marcus Parks on
last
podcast on the left, when he was like kind of poor and growing up in New York, he would have days where it's like you're either going to smoke or you're going to eat. And he would often choose smoking over eating because it's what you could afford it, and you could afford one or the other, and nicotine's so addicting. So you just, and if you have all that dopamine stimulation, you probably don't need
Who needs food?
Your appetite's probably suppressed and nothing tastes good anyway.
That makes sense.
So that's usually why people are skinny. They're just not eating.
Marcus Parks is my primary source of knowledge on smoking. I feel like he's the person I've like heard the most from about like his personal struggle with it.
Yeah. I think I don't know if he's quit entirely, but
I think he's been on nicotine patches for quite a while,
which is great.
Yeah,
that's fantastic for him. I'm very proud of him for that.
I know. I like that he talks openly about all this stuff.
It's really hard to quit.
Yeah.
So let's talk about vascular. I spent the last 4 years of my life in vascular surgery, so let's fucking talk about it.
Yeah.
Peripheral vascular disease is a disease that the leading cause is smoking.
Of course.
Very similar to coronary artery disease and mesenteric ischemia. It's where plaques build up in your arteries, mostly in the legs, but it could also be in the arms. But 99.9% of the time, it's in your legs and your distal aorta. That can lead to cramping. Usually what happens is you get this stuff called claudication, which is cramping while walking. And it could be, walking around Walmart while you're grocery shopping and you get this like severe cramping in your calf or in your thigh, depending on where the blockage is. What will happen is you could need, just like some people get stents in their heart to open up the blood supply. We can put stents in your leg to open up the blood supply, or we can do a bypass where we have to get either a vein or a piece of like plastic tubing and do a detour around the blockage just to get more blood supply to your lower leg. Sometimes this disease is so severe that we can't do that, and you either have to just live with this or you'll end up getting a wound that will never heal because there's no blood supply to it, and we'll have to amputate. Get some dry gangrene.
Don't remind me of gangrene.
Yeah. There's a couple smoking commercials where there's like a bilateral amputee who talks about, I didn't think I would ever lose my legs from smoking, but that's exactly what will happen.
Yeah, I feel like you don't really associate that with smoking.
No. And I will have a vascular surgeon on to talk about this more because I think it's fascinating and why I spent 4 years there. But when you talk about smoking, you hear like lung cancer and leukemias and stuff like that, but you don't think about like losing your legs or your fingers or your toes over smoking.
Yeah.
And I think vascular disease is so insidious because you don't get it until it's like a disease made out of a horror story, I think. Because you smoke when you're young, and even sometimes when you quit, we would see people who are like, well, I quit 30 years ago, but the damage has been done. Yeah. And so you have, you're living your life, and then all of a sudden you're like, wow, my legs really hurt when I walk to the car and back. And then it's worse, and then it's worse. And now you're like, okay, now I need a stent, but the stent doesn't work because it gets blocked again. And now you need a bypass, and then the bypass only lasts a few, years. And now you've got a dead toe that needs amputated. And now you have one leg, and then there's like a cruel joke in vascular surgery about how everybody becomes symmetric eventually, which means, if you have vascular disease in one leg, you probably also have it in the other leg. So if you need an amputation in one leg, you're probably going to need an amputation in the other leg. It's cruel, but it's true.
Yeah. I mean, if that's how it happens.
And it will take years for this to happen, but it will still just, it's devastating.
And then yet another problem with ADHD is that we have trouble like thinking of the future. You know, all teens have trouble caring about the future. It seems like so far off. And then especially with ADHD where you don't have this good perception of time.
Things won't happen to me.
Yeah, things feel like either now or not now. And so you're just not really thinking at all of the consequences. Like it just seems so your future seems so detached from the current.
It's so hard to think about it. And you see these patients and I'm like, I'm telling you, you need to quit now because you're like right at the, we've just started your treatment.
Yeah.
But it's going to get so much worse. It's really...
I remember having that problem even with like tanning, which maybe at some point we'll cover tanning addiction because people get so addicted to that. But I went through a phase. Haley got me into it. Sorry, Haley, but you did.
Yeah.
Haley got me into bed tanning. I don't know. I hope not. I hope you're not still tanning, Haley. You're beautiful the way you are. Mm-hmm. Please take care of your skin. But there were like a couple years there, freshman year of college, where I did tanning.
A little bit of tanning.
Yeah. I did it occasionally. It's so bad for you. Please do not do it. I know you aren't going to listen, but like, please.
That's why there's fake tanning. Get a bronzer.
Yes. There's such good fake tan products nowadays that like you can have the same look and not damage your skin the way it is. But I remember, you'd hear about, you're gonna, on top of the very dangerous health effects, even just aesthetically, it's like, you're gonna look really old and wrinkly by the time you're like 40 or 50. And in my mind, I was like, that's so far away. It's not
it's
even
so hard to
remote concern. Who cares? I'll essentially be dead by then. But now I'm like 34. I'm like 40 and 50
oh my God.
are not that old and they're not that far away.
Right. Yeah.
It's like you got your whole life to be an adult.
Right. And exactly. And like the vascular disease will hit you like usually right around, depending on your smoking history, 50s, 60s, 70s. It's like right when you're getting ready to retire. Now you have all these like chronic diseases to deal with. You can't even enjoy your retirement,
I know.
It's so insidious and it's so terrible. And then bladder cancer, there's a high incidence of bladder cancer in smokers because when the nicotine and all the chemicals get through the blood-brain barrier and then they get filtered through the kidneys and then they sit in your bladder. So all that tar, the benzene, all of those just sit right in your formaldehyde, sit in your bladder until you're ready to pee. So there's a lot of bladder cancers in smokers.
Makes sense.
With wound healing for nicotine specifically. Nicotine, so it stimulates your norepinephrine, which is a vasoconstrictor, right? So back to fight or flight, it will vasoconstrict. If you're always smoking, your capillaries are always vasoconstricting. And so not only will that increase your blood pressure, but if you have a wound of any kind, that blood pressure, especially if it's on a limb, you're not going to have the blood supply to heal that. Many plastic surgeons and orthopedic surgeons will refuse surgery on patients who are actively smoking because they're seen as like, these are elective surgeries. They're not like life or limb threatening, and they're not going to do it if someone's not going to like take care of themselves or they're going to risk their own surgery and their own outcome.
Sucks, but it makes sense.
Yeah, there's some plastic surgeons will even, depending where you are, will make their patients take a nicotine pee test before they go to surgery, just because they're that not obsessed, but they care that much that they don't want their patients smoking. My mentor and one of the wound care nurses I worked with, and my mentor, she taught me everything I know about wounds, used to say, for every cigarette you smoke, that's 90 minutes of wound healing lost. Whoa. And so we used to do the math for the patients. We'd take, 90 minutes times if they smoked a pack a day, that's 20 cigarettes.
Whoa.
And how many minutes is that? It's like over a day's worth of smoking. Or one pack is over a day worth of wound healing lost.
Whoa.
Yeah. And then lastly, cosmetic. You age so much quicker if you smoke. You can look sometimes up to like 10 years older. I'd see this all the time in vascular surgery where a patient would come in, they'd say they're 50. I'm like, you look 75.
I was gonna say, I think it's older than 10 even.
Yeah,
for some people.
Exactly. You get fine wrinkles everywhere. Your skin kind of turns like leathery. And then you get like, especially in the lips, you get those like classic smoker lips.
Yeah.
With all the fine lines.
And you're probably more likely to be out in the sun a lot more if you're outside smoking, right?
Yeah, but not, it's mostly the smoking and not like the sun.
If you're like taking 20 cigarette breaks a day, every day.
Well, it's probably like you're smoking more than one cigarette. I don't know.
I'm just saying.
Yeah.
It's also probably if you're probably not always thinking about sunscreen and skincare as well.
Right. And then you have like the yellowing teeth, the yellowing nails. You don't look good. Like I hope you have a good med spa.
Yeah.
You're going to need it.
And dentistry stuff just sucks too,
It's really
it sucks going to the dentist as it is.
I
hate going to the dentist. I need to go.
But let's talk about nicotine and ADHD specifically.
Yeah.
We kind of mentioned it, but ADHDers love nicotine. They do. This is a fact. As we talked about earlier, nicotine directly stimulates the dopamine reward pathway. We are already always seeking dopamine at all times anyway. Nicotine is especially valuable for us. It does give us that big dopamine hit. Many smokers with ADHD report increased concentration, reduced distractibility, enhanced working memory, and reduced impulsivity.
It's literally self-medicating.
Literally self-medicating. Many people do it.
Yeah.
So let's talk about some statistics. ADHDers are significantly more likely to smoke than the regular population, the neurotypical population. And they're more likely to relapse if they're trying to quit. One study found 42% of adult ADHDers are everyday smokers compared to 26% of the non-ADHD
it's like
population.
Double.
It's like double,
Wow.
right? You're double. Another study found that the more severe your ADHD traits were, the more likely you were to smoke.
That makes sense.
And other depressing statistics include ADHDers start smoking at a younger age compared to the general population. ADHDers progress more quickly in their nicotine dependence. So that means they go from like occasional use or experimental use to like every day, multiple times a day, quicker than non-ADHDers.
Yeah.
Regular smokers with ADHD are more likely to smoke than regular smokers without ADHD, which we already know. But there was no statistical difference, one study found, between hyperactive types versus inattentive types, which I thought was interesting.
Yeah.
And then everyday smokers with ADHD are less likely to be able to quit compared to everyday smokers without ADHD. And one of the biggest contributing factors is that ADHDers go through more severe withdrawal symptoms than non-ADHD people.
Well, that makes sense that you're like adding something that you're lacking as opposed to non-ADHD people who are just like they already have regular dopamine levels. When you stop smoking nicotine, I'm sure it's very difficult and very sucky, but you're just going back down to like regular levels.
Yes.
We're going down to like a deficit.
Yes.
So like, of course, it's going to be hard to like, it'd be like me stopping my ADHD medication.
That's exactly what I was going to say. It's like stopping your ADHD medication.
Yeah. Plus, like we talked about a long time ago about developing habits and how it's takes so much longer for ADHDers to develop habits, and we're very bad at consistency because we have inconsistent brains.
Yes.
So there's like so many factors into why it's so hard to quit cigarettes. I can't even imagine.
It's so hard. I have so much more respect for people who are trying to quit because it just seems like it's insurmountable.
Plus,
but it's not impossible.
Yes, it's possible.
It's definitely impossible. And we're going to talk about it in a little bit.
Definitely not impossible. You just said it's definitely impossible.
It's definitely possible.
Yes. Plus, it's also a stim too. It's like a oral stim where you have something that's like a routine that like relaxes you and regulates you. It's like, I feel like that even like with smoking weed, that's one of the biggest parts
it's like,
of it is like, it's nice to have this routine that you're
having a glass of wine after a long day. You know, it's the same thing.
Something to look forward to that's like going to give you a break and like change your mental state.
Exactly. It's so hard. So let's talk about self-medication. So nicotine and nicotinic agonists, which are things that directly bind to the nicotinic receptors, have been proven in multiple studies to reduce the traits of ADHD, such as hyperactivity and inattention. In theory, nicotine is a great medication for ADHD. The only drawback is that it causes every cancer everywhere. And it will literally clog up your entire arterial system, and you'll have a stroke and all your toes will fall off.
But other than that,
it's great.
I know it sucks that this is so bad for you. Because like, how amazing would this be?
It would be great. In reality, ADHDers, diagnosed and undiagnosed, often use nicotine to self-medicate. So much so that at one time, researchers were looking into whether nicotine could be used as a treatment for ADHD. However, the only article I found that mentioned this in the slightest is from 1996. So my guess, and this is just a guess, is that they were looking into this, and then stimulants like Adderall and Ritalin became readily prescribed that had way less risks. Like they didn't cause friggin' cancer.
Yeah.
And so that like nicotine-based pharmacotherapy kind of just went away. And I've not found any recent articles trying to make nicotine into a some sort of drug. But I've heard about it. But like I said, the last article I could find was from 1996, and I looked really, really hard.
So they must have found that this
like,
is just
this
going to
is
be
probably
harmful.
not worth the risk. And then like if you're on a nicotine-based therapy, what if you also start smoking? You know, it's just there's a lot of things going on.
And stimulants are so effective, and they've been so heavily studied, and they are so much safer. I know there's like still so much panic around stimulants and blah blah blah, but like. This is exactly why we say it's so important that if you need ADHD medication to get on it and to not fall for like the fear mongering, because this is one of the many alternatives that people turn to when they're not being medicated. They seek out their own self-medication, and of course it's going to be more dangerous.
Exactly.
And of course they're going to like abuse it because
Exactly. So let's talk about therapy. So many studies have shown, and the trend that we will find in this substance use disorder series is that when you treat the ADHD first, the patient has a greater chance of being successful with smoking cessation or quitting whatever the addiction is in the first place.
Yep, that makes sense.
From what I've read, many researchers are recommending that ADHDers have the most success when they seek a treatment that is tailored to ADHD. So they're and I kind of tried to look into it, but I didn't really find. I couldn't find anything that like was like, here's a ADHD treatment or support group. My guess is like if you join a smoking cessation support group that also like a specific ADHD smoking cessation support group. That would be helpful for you.
And also like, I'm guessing like if you do have ADHD and you're a smoker, to seek out ADHD medication.
Yeah,
and
exactly.
That will make it easier to quit.
Or it doesn't even have to be medication, but just like therapy management for it. You know, you need to treat the underlying issue, which is the ADHD, before you can treat the substance use.
Yeah, and I'm sure it would make it so much easier to quit cigarettes if you could like replace it with stimulants.
Yeah. And in like life skills and just having that knowledge of like, I'm at a deficit and this is going to be very difficult.
Yeah. Just being aware of it instead of being like, why does this feel so difficult for me?
So we've learned a lot.
We have.
I have some recommendations.
All right.
And these are recommendations not only as your pal, your friend, your podcast buddy, but as a PA and a practitioner of medicine where I spent 4 years of my life lopping off dead toes due to smoking. Let's talk about them.
Okay.
Number 1. Out of all of the ways you can consume nicotine, cigarettes not only are one of the grossest, but have been significantly proven for decades to be the most harmful. So please stop the cigarettes for the love of God. Get rid of them. They're going to ruin your life eventually in 10 years.
And don't start to begin with if you can help it.
If you can stop that to begin with, that's great. But if you're already doing cigarettes, just switch to something else. Number 2. Chewing tobacco / dip is absolutely foul and shouldn't exist.
Yes.
I can't even think about it.
Remember when I dated Kale that summer?
Ugh.
He his friends all dipped, and one of his roommates would fall asleep with a packed lip and then wake up in the night.
Does he have teeth left?
I think he was like, I think he had gum cancer.
Probably.
Because you're falling asleep with this like going right into your bloodstream.
Oh, also, how do you fall asleep with that? That's so much nicotine. Just
I know.
Like,
doesn't that like give you a buzz?
Yes.
Yeah.
Oh my God.
I don't know.
I remember meeting we have to bleep out our name.
Okay.
The first time I met him, he was super drunk and he had a packed lip and a water bottle and he kept talking to me. Yes,
Ew.
I know. Would never expect it. And then he kept talking to me and spitting and I go, I gotta go. I can't. And then he left it on our staircase and I woke up and I was like furious and I was like, I'm not cleaning this up. This is foul.
Makes me nauseous.
It's
to
just
think
like
about.
I can't even. Oh, it's so gross.
I know.
And I'm sorry if that's like your thing, but like get a Zyn pouch.
Yes.
Do something less disgusting than dip.
Yeah, something where you're not spitting brown liquid into a
Please
bottle.
don't spit while you're talking to me.
I know.
It's so gross.
Anything that requires you to like spit out a liquid.
I can't. I just.
It's crazy
Stop
that it's even a thing.
I will buy you nicotine patches.
Please. I'll cover you in them.
I'll even buy you cigarettes if you just stop chewing tobacco. Oh my God.
And that's ultimately the thing. We're not trying to sound judgmental or shamey.
I will shame you if you're chewing tobacco.
I'm saying the judgment isn't about a nicotine addiction because we fully understand
the spitting.
We fully understand how addiction happens, and we don't blame you or judge you for that in any way. But in terms of harm reduction and just general grossness, there are less harmful and less vile ways to consume nicotine if you must.
Yes.
And I would say cigarettes and dip are the two that are
worst.
Like, no.
Yeah.
If you can do anything to avoid these two,
please
consume it in a different form.
Or just in a room alone where no one else will be with you.
Yeah, don't be in a conversation while you're spitting into a bottle.
Oh my God.
And it smells so strongly too. Like the smell just makes me feel sick.
I can't.
Yeah.
I cannot.
And you won't.
And I won't.
And you won't.
We don't have a lot of long-term data on vaping.
Mm.
But the short-term doesn't look great.
Yeah.
If you can't kick cigarettes, at least try switching to vaping. It's technically supposed to be better than cigarettes.
Mm.
So I feel like maybe vaping would be like a good step down. Like if you're a pack-a-day smoker and you're like, I've tried, I cannot, I'm just really struggling. At least try to switch to vaping. And then for everybody, if as of now, one vape pod is one pack. So if you're going through one vape a day, it is like smoking 8 pack of cigarettes a day.
Mm.
So just keep that in mind.
Wow.
And yeah. Cigarettes, they've got a lot of chemicals in them. So does vaping. But vaping, as of now, we know has less.
Not as bad.
Maybe not as bad. Still bad, but not as bad.
Yeah, harm reduction.
Yeah, exactly. The gums and the transdermal patches seem to be the most effective and most studied nicotine replacement therapy.
Mm.
They are expensive, but as is smoking and vaping.
And you're avoiding more expensive medical costs down the road, you know?
Exactly.
So I'd say it's worth it to
Think
invest
about your future.
in the gum and the patches.
Right.
It's worth it to spend a little more money.
Some people like the gum because it's that oral fixation.
Yeah, that's true.
From what I've heard, the gum tastes really bad.
Yeah, I think that is definitely part of it. I know that people will replace that with like lollipops and stuff like that. Just giving yourself
or bubble water,
an oral habit. Yeah, mm-hmm. Yeah, something that makes something happen in your mouth.
Yeah, they even came out. I think I just saw on TikTok. They have these. They're like, you wear them around their neck. They look like little wooden cigarettes and you pretend to smoke them just for that oral fixation.
Yeah. And part of it is also taking a deep breath. People who quit cigarettes or weed say that they didn't realize that the only times throughout the day that they were really like drawing in proper deep breaths was when they were smoking. And part of it is that you're addicted to just deep breathing.
Oh, really?
Yes.
Interesting.
That's part of it. Yeah.
All right.
So I don't know. It's not going to kick your smoking habit, but I think it could help at least with part of it is try some deep breathing. You know, if you're craving a cigarette, try like 5 deep in through the nose, out through the mouth, belly breaths first.
Yeah. And there's a lot of support groups out there. It's just really hard to quit.
Yeah.
But it's never too late to quit. I think even people who are, later in their years, they're like, well, I've been smoking for, 20, 30 years. Why should I quit? Well, because it's still good to quit.
Yeah.
And let's talk about it. It's never too late to quit. It's never too late to start trying because it will still benefit you. Within 20 minutes of your last cigarette, your hands and your feet will start to warm up.
Whoa.
Because the vasoconstricting from the nicotine.
Wow.
So your capillaries in your fingers and your toes are usually the first to close off because it's farthest away from your heart. So your hands and your feet will start to warm up and your blood pressure will drop in a good way.
Nice.
Within 8 hours of smoking your last cigarette, the amount of carbon monoxide in your body is cut in half.
Oh my God.
Right? And it's back to normal within 12 hours.
Whoa.
Right? So,
wow, that's a hopeful thing.
That is right. It's never too late to quit. It's always going to benefit you. Within 2 days, your sense and smell and taste improve. Remember, the tobacco just kills your sense of smell and your taste buds, so you're gonna be able to taste food again. Which
that's a benefit. Yeah. Like, what if you got a big fancy meal coming up? Right? Don't you want to be able to taste it
exactly
to the fullest extent?
Right. At 2 weeks, your risk of heart attack has already decreased.
Wonderful. At
1 year, your risk of coronary artery disease is cut in half.
Wow. Damn.
At 5 years, your risk of stroke and cervical cancer, which we didn't talk about cervical cancer, at 5 years, your risk of stroke and cervical cancer is the same as a non-smoker.
Whoa.
Right?
That's incredible.
Right? At 10 years, your risk of lung cancer is half of someone who is still smoking. And at 15 years, your risk of getting heart disease is the same as someone who has never smoked before.
Wow. All right.
Right?
So that's very hopeful.
Yeah. It's never too late to quit. It seems insurmountable, but it is doable because people have done it.
Yes.
Some people do cold turkey. Some people do the replacement therapy. And it's okay if you have a relapse. It happens. It's so hard. This is a drug that is designed. It directly stimulates our reward pathway. It is like the best thing that our brain wants, but it's the worst thing for our bodies.
Yeah.
So it's designed to be addictive. There's a reason why the tobacco companies and the vaping companies have made so much money. It's because it's so addicting.
Yep.
It's so hard to quit, but it's always, always worth it to try.
What are your thoughts on hypnotism? Because I've heard a lot of people have success with that.
I have had one patient in the past who tried hypnotism, and he said that it worked.
Nice. I've heard that it works obviously not for everyone, but I have heard that it works.
Yeah.
Same with I think maybe you could do it with psychedelic therapy and ketamine therapy.
Yeah, I think from what most people try, so I haven't really heard anything about psychedelic or ketamine therapy. There are drugs like bupropion and which is Wellbutrin, and Chantix that help with smoking cessation. I think the other thing is trying to, because many people who quit smoking, they either gain a lot of weight or they pick up a different bad habit.
Yep. And
so one of the big things is you really need to look deeply, and you can work with a therapist on this, or just do some inner work on yourself. Is what is the smoking doing for you? Why do you need this? So you're not replacing one bad habit with another.
Yeah, that happens so often.
It happens a lot.
Like people who get gastric bypass surgery and then they just become alcoholics.
Yeah.
Because you're just transferring that food addiction to something else.
I work with a bariatric surgeon, so maybe I should have her on the show. But so with the bypass surgery, a lot of times you have to see psychologist, a nutritionist, and an athletic trainer before you even see the surgeon, because you have to, it's a huge lifestyle. This is way off topic, but it's a lifestyle treatment, or it's a lifestyle change. You have to change your relationship with food before we can make your stomach smaller. But if you don't have that lifestyle change, if you don't put in those hours of therapy, you'll either what's called eat through your bypass, which is where your stomach just re-expands, and it's like you did nothing, or you're just going to have severe complications.
Well,
That'll be for another day.
Yeah.
I'll see if I can get her on the show.
Yeah, that'd
she's
be
about to have a
interesting.
baby, so probably not.
a bit down the road.
Yeah.
But I think that's yet another aspect of quitting cigarettes is the lifestyle of it, where you're just used to going outside and having a little break throughout your day, you know? So you could do things like just go and stand outside for 5 minutes. Because I truly think, obviously, that's not like the chemical addiction aspect of it, but truly, I think part of it is that you just are used to this habit. And so
it's a habit.
Building in it, like replacing it instead of trying to just eliminate
feels good.
it.
I'm sure it feels great.
Yeah, I bet it does.
I bet it feels fantastic. How does smoking feel?
Yeah. How did it feel the time you tried a cigarette? Because I feel like your first one doesn't feel good, right?
You're like hacking and smoking.
I'm saying you personally, when you were drunk, that one time you tried a cigarette. You don't remember?
I remember there's a lot of hacking and smoking, and I didn't like the taste of it. And yeah, I didn't do well.
I'm pretty sure my dad's dad did the thing to him where he caught him smoking cigarettes when he was a kid and he made him smoke the whole time.
Oh my God.
That made him sick. I'm pretty sure my dad's dad did that to him.
I would have
never smoked cigarettes again.
Died.
Right?
I also think I had like the fear of Teresa.
Yeah.
My mom. She'd always be like, don't do it.
I was always very, very, very scared of smoking.
Yeah. We were also dare kids. So they were
little police officers.
Yeah.
Yeah.
They're smoking. But yeah, no, I have addictions. This isn't one of them, thank God.
Thank God, I'm so grateful.
Really grateful. But if you're struggling with smoking, it's never too late to quit.
Yes.
It's always going to benefit you, and just understand that my heart goes out to you. It's incredible. It's an uphill battle, but it is worth it to at least try.
Yes. And if you have to replace it with a less harmful addiction, I say do that,
Try a patch, try the gum.
Yes.
Talk to your doctor. There's the medications. One causes like nightmares sometimes, so careful. Chantix has been known to people will have like lucid dreams and nightmares.
Wow, that's kind of interesting. That's something new.
In a bad way. If you've ever, I've talked to a couple patients who've tried Chantix and it did not go well, and they're like, never again.
Yeah, lucid dreaming.
Never again. I thought I was losing my mind, and I'm like, okay, all right, well. Yeah. You're going to lose your toe. But
your mind or your toe, you choose.
I joke about it, but it's like for serious. Yeah. So my plan is to have a vascular surgeon come on, and I'll talk to a lung surgeon too to see if maybe they'll come on and talk about it. My plan is to not really have them like be berating about smoking, but just talk about their job and how they, smoking has kept them employed for so many years.
Yeah.
This kind of seems like a bummer of an episode, but I think it's an important one. I think there's so much data on ADHD and nicotine. It's crazy.
Yeah.
And no wonder why, because it's like a direct line to the one thing that we want most in the world, which is that dopamine.
Yeah. It makes total sense.
It makes a lot of sense.
Yeah. All right, and that's it.
All right.
All right. Thank you guys for listening. We'll see you next week.
All right. Bye.
Bye.
Ah! Ah! Ooh. Ooh. Ah!
Nice.
Bye.